But let's just start out. First, thank you for coming in from
Sure.
Chicago. It's great to have you here.
Good to be here.
And just introduce yourself, and for people who are not that familiar with Delta Dental,
Sure.
What is Delta Dental and your role there?
Sure. Well, my role at Delta is Chief Dental Officer, so I'm responsible for the overall quality of care and delivery of care for oral health care for our company. Delta Dental is a federation, similar to the Blues, a federation of companies that actually operate and sell benefit plans under the Delta Dental brand. I work for Delta Dental of California, as I hit the microphone. And our company manages the Delta Dental brand in 15 states for our fee-for-service PPO programs, plus DC, Puerto Rico. We also manage for the entire Delta system all of our national dental HMO programs, as well as we do all the engagement with federal programs. So all in all, we're managing about 45 million lives in our under management.
And talk to us about the importance, and I've been sort of going through it recently myself, the importance of dental health to your overall health.
To your overall health. So, that when I'm asked this question, I always say my goal in life is to put the mouth back in the body. And while that sounds really, really very obvious, I mean, where do you eat your pie? Mm-hmm. So, but from a healthcare standpoint, we tend to peripheralize dental. We segregate it from a healthcare standpoint, both from a benefits plan standpoint as well as from an overall health standpoint. And there's loads of evidence that connect oral and systemic disease. As a matter of fact, it's recent NIH evidence shows that oral health contributes or is a risk factor in over 60 systemic diseases, and some pretty heavy hitters. So very influential in hypertension and cardiovascular disease, diabetes. Emerging data connects the inflammatory factors in oral disease to Alzheimer's disease. So that periphery that dental has set for years and years and years needs to start to integrate into the overall health. I found it interesting that in the digitization, the engagement, patient engagement up there, I saw mental health, I saw lots of things. I didn't say oral health at there at all. So I'd love to see a floss challenge out there.
Give us a brief day in the life being the Chief Dental Officer at Delta Dental. What do you do on a day-to-day basis?
So one of the things that I do is this kind of thing, put the mouth back in the body, to try to get the word out that oral health is health. And often when we think about dental insurance companies like Delta Dental, we think of it as an insurance company only, and we're a health plan focused on oral health. So we are managing the entire plethora of patient engagement, provider experience, activities on an ongoing basis, and that's what I'm responsible for, and that's what I do on an ongoing basis. We look at that consumer data to try to determine how best to take care of providers, how best to take care of patients, and engage in that way. We partner with multiple health plans out there, and we sell benefit plans to across the entire spectrum, from PPOs, HMOs I mentioned, Medicaid, Medicare Advantage plans. We're partnered with many MAO plans out there to sell benefits, and making sure that utilization is appropriate and correct with providers, making sure quality is high, holding providers accountable for the care that they deliver. One difference between medicine and dentistry is low cost, high volume. Encounter rates generally are 70 to 75% of our enrollees visit the dentist annually. So that's a lot of engagement with providers, and making sure that providers are engaging appropriately and diagnosing and delivering care appropriately is core and central to what I do.
Before we sort of dive into innovations happening in dental and oral care and things like that, talk to me about how the industry is sort of structured, and is it evolving? Forward Health, we just heard about Forward Health.
Yeah.
We interviewed their CEO at a recent event, very interesting. Are we starting to see more of those types of, I'll call them, even though dentists are certainly direct to consumer, but these sort of direct to consumer models? Dentists have always been sort of individual islands, if you will, maybe not part of, a hospital might be part of a larger hospital system or group. Is there evolution towards that where there might be consolidation so it's a little bit easier, whether it's getting a health plan together, whether it's being part of a PPO, these types of things. But talk to us about the industry sort of writ large. Is it going to stay fairly individual with dentists being sort of individual up on their little islands a little bit? Or,
yeah.
And are there these interesting models like the Forward Health as well, where it's some kind of storefronts on the street?
Yeah, so yeah, like you said, dentistry has always been kind of like the storefront on the street. I mean, the pillar in their community, that kind of, colloquial description of a dental office, sponsoring the local soccer club or the kids' little leagues, stuff like that. You often see that kind of stuff, and that continues. It is evolving. Dentistry, the delivery of dentistry is evolving. However, it's not evolving quickly. 65% of dentists still practice in solo or small settings, employees of 4 to 10. And you mentioned the word innovation. That, it doesn't inhibit innovation, but it makes it very slow because you have a very, very, not only do you have a very diverse population of dentists that you got to get to try to get them to adopt innovation, but they're all small businesses and typically don't have the finances. And so that's where we as a payer step in to try to facilitate that innovation, to try to help fund it as necessary, to try to move the industry along. There is consolidation occurring in the DSO market, the dental support organization, very similar to the MSO markets on the medicine side. And some of the larger DSOs have 1,000-ish offices. And when you consider there's 210,000 practicing dentists in the country, that's still a very, very small thing. That growth is fueled by just the massive amount of debt dental students are coming out of, over $300,000 average debt load. Yeah, just a massive amount of debt. And so that's fueling, new grads. 50% of new grads are going into that DSO setting. So we're seeing it accelerate. However, we're also seeing, that front door is wide open, but the back door in the DSO setting is also very wide open. That's why we're not seeing that percent practice in the DSO setting skyrocketing with that kind of debt load. It's because they come in, get their speed up, get their clinical expertise a little more honed, pay down some debt, and then they're less of a risk for a bank to go out there and start their own practice.
You're also a practicing dentist, so you know what's going on from that perspective. So I'm curious where, maybe as we talk about innovation, let's start with the pandemic, and virtual care became obviously a big thing. Did that happen in dentistry? Obviously, it is a form of care that it's very important to be in person, right? But did we see the beginnings of that? Did we see some virtual care during the pandemic?
Yeah, we did. And it would be super cool if you could reach through the phone and fix somebody's teeth. But we're, a Star Trek generation away from that happening. So, but teledentistry did evolve very, very rapidly. Because as you said, when you think, just think about going to a dentist. Nobody thinks about doing an engagement with their dentist virtually, right? You're not going to get your teeth cleaned through the phone. So there's a very, very limited number of services that can be delivered. And generally, it's consultation. And so we saw the adoption of consultation skyrocket. Dental offices closed down completely, except for essential services, emergency services, through the pandemic. And depending on the state, some states, some of the states in the Southeast opened right away after about 30 days. And some states like California, New York, Massachusetts, it took 90 days before they were allowed to come back and actually see routine care. So we saw the adoption of that telehealth connection. And while from an innovation standpoint, that isn't necessarily novel, the connection and the willingness to connect in that way, I think, is what the novelty kind of brings. I think the innovation will start to occur, the technology development will start to occur. So we're seeing discussion around digital scanners that you connect to your phone, so you can actually see through the density of a tooth. And while you can't still fix that tooth through the phone, what it can do is it can facilitate delivery of care in places where there are dental deserts. Take a picture of your tooth or your pain or whatever with your phone, and that can help us triage whether you need to come see us right away or whether you've got some time and we can get you scheduled.
It's like any conditions, right? It's about catching it early, right? So it's
absolutely.
Like you can do that. Sort of shifting to in the office, I have a fantastic dentist in New York. He's great, but you always kind of look at the machines when you show up, and it seems like there hasn't been a lot of innovation, maybe in his office in particular, in terms of the machines and the tech. But for some of the more progressive dentists that or have seen, just anecdotal evidence, what's happening in the office where you see technology innovations, whether it's in imaging or things like that?
Yeah, I think about that in like three different buckets, like the clinical innovation. And certainly there's a lot of clinical innovation going on. A lot of work around nanotechnology in restorative materials, restorations with nanotechnology that will harden the tooth structure to make the longevity of those restorations much longer, fight decay, that kind of stuff. Also, osseointegration of nanotechnology to improve osseointegration of dental implants, periodontal surgeries with nanotechnology for grafting and things like that. So clinically, there's a lot of work going on, and I would say that's been an ongoing effort. A lot of patient experience innovation going on, and like I saw some of the patient connection and connectivity. A lot of work going on in how do we include the patient in that experience. If you think about going to your dentist and getting your teeth cleaned, you're spending 2 hours a year in a dental office. That's the health care part of it. There's 8,780 more hours in that year that your oral health is at risk. And how to engage patients during that period of time is where a lot of the experience innovation is coming. So I've mentioned, love to see a flossing challenge. Not that anybody's going to be jumping up and down to see a floss challenge on their phone. However, those kind of connections and that kind of home care is what prevents that risk from escalating from a lot of systemic disease.
We see a lot of, whether it's a trade association or even the hospital groups themselves, pharmas have labs and innovation centers, and are there any there's the American Dental Association, but are there innovation labs and centers, or are there particular universities that are excelling in terms of really teaching, so whether it's innovative technologies or innovative techniques? Where's the center of gravity for innovation in regard to the dentist?
Well, we're certainly trying to develop an innovation center on the West Coast, and we're partnering with certain organizations, education schools, to build that innovation. Whether it's patient engagement or whether it's technique, we're working on building an innovation center today. Certainly, there's a lot of innovation at dental schools. There's not that many dental schools around the country, so there's a consolidated amount of knowledge in those university settings, and that's where a lot of the innovation is occurring.
To switch back over to the insurance side of the business and cover it does seem like dental insurance, and whether it's through your employer and those plans or just even is getting a bit more accessible. It seems that way to me. Mm-hmm. What's sort of the trend there in regards to insurance and just accessibility as well, in terms of partnering with HMOs and partnering with different plans and things like that.
Yeah, certainly accessibility and equity is kind of like the word of the moment. So we work in all spaces. We sell Medicaid plans. We work with MAOs and partner with them with whatever type of Medicare Advantage plan might be available. We're seeing a shift from some of those skinny Medicare plans where they might cover a cleaning a year or some x-rays to a very comprehensive package. And I think that many people are starting to understand the connection between oral health and systemic health, and I think that's what's fueling it, plus funding, money. So we're seeing a movement in that direction, and I think the integration of the data clinically is starting to drive some of that movement.
Well, that's a great segue, because it's sitting there on my mind, and my next question is about data. We're going to talk a lot about health data today. Ryan Argenteri is here from ONC and talking about data. Where does my data go as far as my dental care and my relationship with my dentist? Is there a central repository somewhere? What happens to the data?
Well, so that is a good question. Because up until today, I mentioned at the beginning, putting the mouth back in the body. This is where we need to put the mouth back in the body, or put it back together with the body, because generally where the data has sat is in databases like ours. You know, we're the first dental insurance company. Group number one is still group number one with us. And that data is housed with us. And so a lot of it is, dentistry has been very siloed in its data. Your electronic data, your electronic dental record is probably sitting at your dentist's office.
Right.
It is probably not, it's probably not being uploaded into an EHR and integrated. And while, from a treatment standpoint, I can't say that a physician's probably interested in whether you have an amalgam in your mouth or a posterior composite or an implant. They might be interested in the injectable medications that you receive to get those.
Right.
And conversely, the dentists need to understand, what diseases or systemic issues you may have. So if you have, arrhythmias or things like that, and the patient hasn't been honest with the dentist, they might be injecting epinephrine to control pain and impacting that arrhythmia and just not even aware of it. And so that connection, that connectivity in that kind of health data, we're finding is much more central to the treatment of the patient and the global picture of the patient. We even see patients going to allergists over and over and over and over again, and to come to find out they have a metal allergy and it's the amalgam in their mouth that's actually causing their systemic condition.
Interesting, fascinating.
Yeah, and it's just not connected right now.
I want to close with health equity and access, and we're talking about that a lot today. We have the Mobile Healthcare Association is here today, and they're out there, the RVs and clinics on the medical side. What is Delta Dental and the industry doing more broadly in terms of to improve health equity and access for everybody?
Yeah, I mean, dentistry historically has kind of taken a you will build it, you come to us scenario. And I think we're coming to the realization that we can't actually operate in that model anymore. We need to take dentistry to where they are, whether they're clinics and schools. For example, taking clinics to schools to deliver sealants, which evidence shows delivery of sealants prevents oral decay. So if we know that treatment modality is critical and central to the delivery of care, then why aren't we actually delivering the care? And generally, it's an equitable problem. If you take a look at some of the emerging data around encounter rates, I mentioned 70% go in. Well, that is a very general term or general fact. When you start looking 2 and 3 layers deeper into that data, it's a very inequitable delivery of care. Kids in general, you see white populations going to the dentist at 60, 70%, even 80% in some states. And think about it. Anybody that has kids around here that hates to go, you hate to go to the dentist, or you have fear around the dentist, you don't want your kids to have that fear. So you take your kids, and that's what we see generally across the board. But that's not what we see in Black and brown populations. Right. And so how do we as a plan message those populations differently so we're actually reaching them in the language, in the way? And when we can't just improve the oral health literacy in that way, how do we take mobile clinics out? How do we move to schools? How do we go to, I threw this weird comment. It's like, how do we talk to a homeowners association at Sun City about bringing oral health care into the conversation there? Because, if you think about the prevalence of the disease that actually causes and increases your risk factor, it's periodontal disease. And 66% of people over the age of 65 don't have insurance because it is not covered in core Medicare and have some form of periodontal disease. And people are not talking about it. People are not talking about it with their physical conditions with their dentists. They're also not talking about their oral health problems with their physicians. And we're trying to get out and message out. It's like, hey, doctor, have you asked your patient when they saw the dentist and if they have periodontal disease and when they had their last periodontal examination, just to start the conversation around the connection.
That's great. We are at time. Thank you so much for enlightening us about the industry for those of us who didn't know about it and the importance of dental health to oral health.
Yeah.
And thank you again.
Absolutely.